Up. Where you at, Grady? Can't see you.
It's okay. You don't have to see me.
Alright. On the way to the doctor for our first meeting after starting chemo. Should be a pretty simple visit, do some blood work and let them know how I feel.
5 days chemo?
Yep, 5th day. Other than the episode last night, which I'm sure was onions, I'm feeling fine. And pull on out here. We'll talk to you in a minute. We are at Cancer Health. SSM Cancer Building, going in. And there's Grady. Grady, say hi. So, a little chilly. Not too bad. Anyway, we'll be back. But I'm off of those now. I feel so much better.
I bet.
I'm getting my taste back now.
Good. Are you hurting anywhere this morning, John? No words.
No idea.
How long have you been on your medicine? You finally got your medicine.
5 days now.
5 days.
Yeah.
How you doing on it?
Good.
Good. Any side effects? And nausea, vomiting, diarrhea, constipation?
I can't attribute it to the medicine.
Okay.
I went back to bed, got another 3 hours sleep.
Good.
So that's the one thing those steroids did to me. I've been having trouble staying asleep.
I'm gonna check that again because I got 134 over 82.
It's been low.
I think I was 128 over something last
At the
time.
hospital? Was it at the hospital that you
Yeah.
were? Yeah.
Never ever have I checked it and it. You're not
like
like gonna pass out on me or
Everybody,
anything, are you?
Katie's about to pass out. My blood pressure's really low. Should I relax?
you're all right.
I was gonna take a daytime. I said no.
Holy crap. 130 over 82.
Nice. High five. Air five.
Wow. I think in all the time that you've been seeing us, I don't think it's ever been that low for me to check.
Your
Yes.
blood pressure was almost better. It was actually better than mine.
You know what? I've lost all that weight.
And that definitely, could definitely help also.
I plan on getting down below 200.
Anything else that I did not mention?
I don't.
Bless you.
COVID.
Stop it.
Jeez.
Don't
No.
aggravate your wife.
No.
How's your mood been?
Great. Until we went to Saucy Dogs.
You went to where?
Saucy Dogs.
What is that?
It's a place in St. Charles by Bass Pro Shops.
Okay.
It has hamburgers and hot dogs,
Oh.
and it was miserable.
Really?
We did a food review on it, and it was the worst place we've ever been at.
Really?
But yeah, my mood is great.
Yes, it has been.
Good. Okay. Well, let me go get your day.
Can you look at the last visit and see if there was a lump on my head, and Julie, I'm pretty sure she looked at it,
Okay.
and she just kind of didn't really comment. She said, oh yeah, or something. I want to make sure they noted that because it has gone away.
Oh, okay.
When I started the chemo,
Let's start going down.
I could tell, and now I challenged Greta to find it last night, and she couldn't find it.
Okay. Shortly.
Have a wonderful week.
You too.
Thanks. Hey!
It's
Did you
squeaking
hear
again.
that squeak?
I did.
Man, I forgot the oil. Dang it. I forgot the oil, Greta.
Well,
I was gonna bring it.
sorry. Sorry about you. Oh, this isn't working that way.
They're squeaking. Wow. I can't believe they haven't fixed that. I'm going home, get the oil. I'm coming back, and I'm gonna do that. I cannot believe building maintenance hasn't done that. Oh, what is that noise?
You wouldn't even know.
It sounded like it was coming from your phone.
No.
What is
Makes no
that?
sense.
I mean,
That would be silly.
Maddie probably would know what it is. You don't know what that is? It
Mm-mm.
comes from your phone.
It just goes off once in a while.
Really?
Why
I
am I
can
not
ask
getting any
Maddie
bars
if
in
she
here?
knows what that is. That big old belly, 216, and it's still sticking out. Looks like a bat up on the wall behind me. What is that? Oh,
Yeah.
it's holding the pictures. Okay. Hello.
How we doing in here?
Good morning.
Doing really good.
So you feel like $1,000,000 out
I
here?
do.
That's encouraging.
I am really doing great.
You don't miss the steroids?
No, I still have some kind of jittery side effect still, and taste buds aren't quite back yet.
Yeah.
But yeah, the steroids kind of messed me with sleep, taste, and just, I was up at 2 o'clock in the morning, and
Yeah.
which I still wake up early, but I'm retraining my body to go back to bed instead of getting up, so. Blood pressure's good. I'm down to 216 pounds, which is kind of intentional in a way. I want to get below 200. I changed my diet, and it seems to be.
So tell me about what was going on with your neck, was it?
It was my head. I had a lump on my head in this area,
Yeah.
and it grew. All of a sudden, it popped up, and we had it noted at the hospital. And all they did was comment on it. I said, "Hey, this looks kind of like the back of my neck. It feels like it. Can you take a look at it?" They looked at it. They never confirmed whether it was melanoma or it looked like melanoma. They didn't do a biopsy or anything. But when I started the chemo, it's gone now. It disappeared in 3 days.
Well, I'm encouraged.
Me too. That's a good sign.
Here's the thing about BRAF therapy is there's almost no therapies that we give people that works as fast as BRAF therapy. So when it works, I mean, that's what you would see. I mean, you might have a lymph node or a soft tissue subcutaneous deposit, and they can disappear in days.
Yeah.
So I think that's all fits with what we know that's how these drugs can work. So that's all encouraging. You're tolerating it well, so we're just gonna keep on
We're
trucking.
in day 5 now, so we're gonna keep chugging along.
I have a question though about,
Yeah.
when he was on the other chemotherapy before and how it affected his left eye.
Yeah,
Oh, that's another thing.
yeah.
I'm sorry. Go ahead. Go
Should
ahead.
he maybe get on steroidal eye drops to keep that from happening again, or?
It's a good question.
Well, let me interject first.
Yeah,
We were driving home from her mom's house last night. When I went to the eye doctor, I couldn't read letter E with
Yeah.
my left eye. Last night, we were driving home, and I covered up my right eye, and I was able to read, obviously not 20/20, but it was
Yeah.
more like 20, 30, 40. I could read the signs then, and I just kept reading them. And so the eye seems like it's getting better.
So I think, your vision's gonna be tricky. You have, when you went to the optometrist or whoever you saw,
Mhm.
you had a little bit of basically edema. So there was just a little pressure he could see, probably from all that stuff going on in your spine. That should get better, which it sounds like it is, if the drugs work.
Uh-huh.
That side effect from these drugs is just sort of a different process. I mean, it's a fair question. Would eye drops help? I'm gonna look into that. I've never seen any data for using that as sort of prevention. We'll see if that's an option.
Okay.
We're just sort of hoping right now that even though these drugs are similar, they're not exactly the same, so it's reasonable to presume you'll have benefit without some of the side effects from this.
Mhm.
But I'll look and see if there's any data. I've never seen anything where using steroids topically to prevent it would help, but it's a fair question. But
I asked because the eye doctor said that her sister had the same issue. She was on chemo, had the same thing happen, so they had to keep her on drops to keep her
Yeah.
eye from flaring up again.
well, there's a drug that we use a lot for leukemia patients, and that drug actually gets into your conjunctiva and your tears. Literally, it's almost like a chemical burn. So we've always used steroid drops, but this really isn't. It's a little bit different, the mechanism for this. It's not as much that it's in the fluid, it's actually in the, I don't know if it would help it for this case. I don't know, let me look into that and see.
We'd rather be on fewer drugs than more, but I
Yeah,
just,
yeah. And if seems it's clearing up, then
Yeah. But the eye drops is an interesting idea, but let me dive into that. But otherwise, I think everything's going great.
yes,
Your,
I concur.
your imaging is all at Barnes, I think, recently, right?
Yeah.
didn't we bring it up though to Dr.
It's
Bennett?
it's over in Bedwinnick's office
Oh,
right
he has the
now.
MRIs?
He was gonna upload everything into the system. I'm gonna go over there and pick that up today. He should have been able to get all that in there.
You were gonna get the disc?
Yeah, the disc's over with Shannon.
So the issue is, there are facts in here. I mean, the reports are in here. I don't know if the images are in here, which doesn't make a difference for like today.
Right.
But at some point, when we're gonna do a follow-up, we're gonna need, unless we send you back to Barnes for your imaging, which we could do, but we're gonna need those actual images uploaded. So that has to go to radiology. Like, we can't do that here.
Oh, okay.
So that's what I'll be honest with you, the chance of us getting these back are pretty low.
Getting them back to me?
Yeah.
What?
Disc.
Oh, you're not getting them then.
So, I don't know.
I can go down and get more if I have to.
Yeah.
You know, no big
Well,
deal.
let's see what happens. We're gonna work on that right now.
Okay. Whatever. They're always. How long do they keep those down there? Do you know?
Oh,
Have
then
any
you can
idea?
get them whenever.
Yeah. I just like to look at stuff, and they give me image numbers and stuff. I'll pull them up and see what they're talking about.
Yeah.
I get curious like that. Keeps the mind busy.
They're particularly sort of, especially before, man, you can pull up images, and they're easier for people that don't look at MRIs and stuff to sort of see what's going on.
Yeah.
All right, let's do that. I mean, it's not urgent, honestly,
No.
but we're gonna want to have those up. So when we send them to PACS, I don't even know where they go. They go to someplace in radiology. Now they're loaded. What we do is we just put the scans in there, but that disc is gonna actually have to go someplace.
That's okay.
Let's
That's
have
fine.
Katie.
We can always get another one if we
Yeah.
need to.
But-
Hey,
Yeah.
Can I come back here and fix the doors? I was gonna bring the oil and a rag and oil these things down.
Is this the same room you're in? I don't remember.
Hey, Maya, is this 3?
Yeah.
Yeah. And then I heard another one down the hall.
You know what?
That is crazy. Building maintenance hasn't fixed that for you. I'm off till noon. I will come back and fix every single door.
Come back once a week. We'll put you in a different room each week.
There you go.
I will bring the oil next time. I was thinking about that this morning. Are we done?
Yeah.
Oh, okay.
Can I do what?
We're gonna get double appointments because our doors are.
Yeah.
Oh, this one's not bad.
No, there was another one out here that squeaked really bad.
Did he tell you that his blood pressure, first time in all the time that I've seen him,
It's pretty good.
is actually normal?
Can you believe that? It's not 178 over 105.
I know.
All right, project.
Okay.
His CD from Barnes.
Okay.
Radiation has it.
Okay. Needs to be taken downstairs to be loaded into packs.
Yes.
Okay.
Will we get that CD back?
I can write a note on it.
You know, I mean, I can get another one. It's no big
We'll
deal.
see if we can get it back.
Yeah.
Because he would like it back. I mean, I said this is a 50-50. We usually don't get it back, but
Yeah.
I'll put a note on it and say that
we'll
I
try
want
to
it
get
back.
it back. You can
Okay.
always
When it's
get
done.
another one. at
Right,
Barnes,
right. And if he doesn't have it for some reason, I can go. All right. No, it looks great, as usual. All right. So what do you think? Ready?
I think your blood pressure was amazingly good,
Yeah.
and sounds like the medicine's definitely helping. He was very encouraged.
Yes. I'm very encouraged. What you were saying something about CBD and stuff.
Oh, well, your blood pressure was down when you were in the hospital too, and that was before had you started taking your steroids yet?
No, they put me on steroids in the hospital.
That's what I thought. So I'm wondering, what's bring the blood pressure down? Does the CBD oil help with that? Or does CBD help with that too, or is it
I believe it does.
taking a baby aspirin every day? Does that help with it?
I think we got a combination of things going on here.
I mean, there's
Because
something
I
going on.
lost some weight. That's a big influencer.
But you had at that time you hadn't lost that much weight. That's a couple weeks ago.
Oh, that's true. I was at. I argued with Lauren. It was 226 or 228 in the hospital. Remember, and I finally
Yeah.
reweighed at 224, and I changed her numbers on the board.
Right. But I mean, you've lost weight before. It has not brought your blood pressure down that much.
No,
Something's bringing that blood pressure
I
down.
think my attitude,
I think that's part of it too. And you're not in pain. I think pain makes your
stress.
blood pressure go
Yeah.
up.
So people, attitude's a big thing here, I think. I just said that and it just hit me. Attitude. Attitude is all about affecting your health. And when you're stressed out, that ain't no good for nothing. Stress is your enemy. Get rid of it, clear your head, communicate with your family about anything that you feel you need to communicate and get off your chest or out of your mind. And they will understand because it's something that needs to happen. Communicate. All right, good meeting.
Very
Right,
good visit.
ready?
Very good visit. Yep.
All right. We'll see you later. Bye.